Good morning, everyone. I hope everyone is doing well. We're here meeting for our September board meeting. Uh, since we're getting started a little bit later than usual, I want to move on quickly to calling the meeting to order. All right. For some reason, my mind is blanking. Does that require motion?
No,
I don't think it does.
no.
These 9 o'clock meetings. All right, so we have a few presenters today, so I want to get through a couple things that before then. We have Carson coming in at 9:15, and I scheduled him to about 9:30 for the legislative report. He might take a little bit shorter than that, but and then also from 9:30 to 9:50, Susie Rigas is going to be joining us as kind of a introduction to a national group which is seeking to kind of across mental health professions improve our relationships with insurers. So I'm looking forward to that. The first thing I had on my agenda, and I apologize for not getting it out to you, would be the approval of the minutes. Carol, did you get a chance to send those out?
Yeah.
Okay. And did everyone have a chance to review? Okay. Do we have a motion to approve the minutes from a particular meeting?
I motion to approve from August meeting.
All right. Do we have a second?
Second,
All right. For everyone who wants to vote to approve the minutes of the September meeting, please say aye or raise your hand.
Aye.
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 All right. That appears to be unanimous. So the motion passes. All right. And then the other thing it seemed come through was the financial report from Kristen. And so I wanted to see if you could do a little bit of explaining and discussion of that.
Sure. I think as mentioned in my email, we're paying our bills, or as you can see in the reports, we are continuing to pay our lobbyist every month, which is our largest expense. Due to budget constraints, we did ask our admin assistant to take a few months off, including the month of August and September and also October. So we will see some shifts on the next reports. The notation here for that line item for $400 was from July's payment. We are operating at a deficit. July and August have historically been really low months for renewals, and that continues to be the case. So it's a small deficit. I anticipate with some of those changes, we'll see that balance in the next couple months. That is all I really have. I will just add, we did have, this won't be seen on that report, excuse me, since it happened in the month of September, but we do have a new lifetime member. So just extending a thank you for that individual. And also we've received some donations, a pretty significant donation to help with legal fees. So I just wanted to acknowledge that. That's also not noted on the report.
All right, thank you. Yeah, that kind of matches up with what we expected. Hopefully coming into this next month will be a good month as far as memberships. One thing I had a question about, and as we kind of wait for Carson to join us, maybe I should have told him 9:10, was how have the monthly groups been going as far as for supervisors and consultation?
Well, I can speak to the consultation groups. I think Larry, your supervisor, is just starting this month, if I'm correct.
Yeah.
Okay. So for the supervisors, we've been meeting regularly the second Tuesday of every, is that correct? Second Tuesday of every month at noon for 45 minutes. Last month we had 3 attendees. The week before that, 3 as well. So it's been lower attendance. So we do encourage people to attend, but they've been very helpful, productive. I don't know what else to say about that. Did you have any other questions, Chris?
No, it was just because we hadn't really heard about it too much in recent months, so I just wanted to check in and kind of see what the attendance was like and whether people were engaging with it.
I can give you an update on mine, which is next Thursday is the first one. 12 people are signed up for it. I put out a mailing just yesterday and got 5 more people signing up as a result of that. They're all, well, one of them isn't, we'll have to contact that person, but they're all supervisory members. And I sent that out also to lifetime members because they didn't, we didn't know if they're excluded or not. So it looks like it'll be a good group. So,
Great.
yeah, maybe we'll get more before then because I'll send out a reminder just before
Okay.
next week.
Can I also add to that, Chris? I'm sorry. Larry made me think about that the number of attendees that are registered do tend to be 8 to 10 on average for this consultation group as well. So I think just kind of people forget or things come up. So the attendance actually ends up being a little lower,
Yeah.
but there is interest.
And we try and send out that reminder, like even to yours, Kristen, like the night or the morning, send out a reminder even in the morning that, you registered because we can do that really easily.
I was just about to ask if we were able to do that because that might have helped.
Yeah, Zoom lets you do that real easily. You can just click and sends out a reminder to everybody.
Great. Okay. And then, hello, Joy. I saw you come in. Hope you're doing well. I did want to check in. I know we had talked about doing the strategic meeting in October. Do we have any planning on that in terms of location? I just wanted to kind of check in.
Do we have a date?
I know we had discussed the 12th, but I don't know if that was ever finalized.
Well, I'll just say the 12th won't work for me. That's my son's birthday weekend, and we just actually booked a party, his birthday party that day because I'll be also going out of town for a week later that month. So it's a busy month for me, but so I'm just putting that out there. I don't know if that won't work for me.
I have it written in as October 13th on that Sunday.
Oh, okay. Does that work for you, Kristen? Sorry.
It can work. It's just really hard for me because my husband works weekends and so I don't have childcare. So it's really my oldest son is at college. So having several hours on a weekend is really just not easy for me. So I prefer a weekday, but I can try. I mean, I can look at getting childcare. The issue is I'm going to be out of town for a week after that. So my typical childcare is already being used. So
Gotcha. So maybe check on that, let us know, and then maybe we can adjust our plans as necessary.
it's also easier for me. I know we want to do in person, but if I could be available virtually, then my kids can be home. It's just easier for me to do that. So if that's also an option, even if the rest of you are in person, that might work better.
Okay, that's something we can consider. Okay. And then Lori, I wanted to check to see if you'd had any ideas in terms of like networking or community events that we could put on or organize.
I have not, honestly, the past few weeks have been a little bit overwhelming, but I would love to do more of that and maybe sit down and brainstorm with a couple of folks about what seems feasible.
Okay. Is there anyone who is able to kind of take some time for that? I mean, after 2 weeks from now, I'll be on vacation for the next 2 weeks, but after that, I'd be available for that.
Okay.
So if anyone else is willing to, please email Lori. And Lori, if you'd interface with that for the couple weeks that I'm going to be out, and we'll make plans after that.
Yeah. Yeah.
All right.
That would be great.
Well, Carson, it looks like Carson has joined us. Thank you, Carson. Why don't I turn things over to you for a legislative update, if you're ready.
Yes, sorry, just getting off mute. Well, good morning. Got a couple of high-level updates and then a couple specific ones that I wanted to touch on. First, obviously, haven't had a whole lot of session days this fall. It looks like the big day, I guess, when everyone's going to be in town is September 25th, when the House and Senate are going to be in town. I think there are still some attendance issues possibly, but that's the day they're at least going to try and move some stuff. Haven't really heard what that is going to entail yet, but there's fundraisers and everyone seems to be planning stuff in Lansing on the 25th. So may see some stuff around that. Even dating back to when everyone was supposed to be in town on September 11th for the 9/11 ceremony, the House didn't even have a quorum, which means they didn't have 56 members present at the time of session. So they're obviously very focused on being out on the campaign trail and being back home in districts, and the ever important election here in November, which will decide the fate of the majority in the House, is still top of mind for everyone. With that being said, one thing that I have heard that we may see come up probably in December is a push for the school safety and mental health funding that was previously cut in this year's budget and redirected. There are a couple policy bills that are bipartisan that they're trying to move forward for mental health in schools and around school safety, such as requiring a mental health professional as part of a threat assessment team in every single school district. Obviously, the biggest question with that is, where are all these mental health professionals coming from if there's a shortage across the state, especially in rural and isolated districts as well. So I think that's something that they're trying to wrestle with. But really, I think the thing that we'll see is that funding restored. We actually just saw a Senate bill reintroduced to restore that funding, Senate Bill 1005. It was a Republican who introduced it. I don't know how likely that one is to move through the process, but I know it's at least a part of the larger conversation as we head into the fall. Couple other quick updates. First, I had a virtual meeting with Alyssa Cravens, the new director of appointments. Actually, it was via email. About appointments and open positions, et cetera. And she sent over basically a whole list of vacancies for the upcoming from now until January 2025. And I went through it and I noticed that the Board of Counseling seat that was expired last year in June is not on that list. So I reached back out and I said, hey, can we get together? I wanted to let you know that I think there's an opening missing from your list. Can we talk about it? Is this an oversight? So I'm hoping to get that scheduled in the next couple of weeks, but it is at least on the director of the appointments division on her radar that there is possibly a mistake. And I'll go through the whole history on how there was someone who was appointed, but they were a school psychologist. So then they were appointed to the Board of Psychology, and then this one is kind of sat vacant for coming up on a full year now. So that's in the works, as well as 2 meetings with Representative Brabeck and Puri that we've talked about in the past. They asked if we could do it in early October to meet with them, and specifically Representative Brabeck is interested in talking about that clawback bill that Carol you sent over to me. So we're going to get those scheduled. I'll work with whomever from the MMHCA team needs to be included in those, but kind of shooting for that early October ish to get that done.
Okay. I'm supposed to be out of town for the first week, but if it happens during that time, just let me know and I'll make arrangements to be present.
Oh, and we can push to the second week of October too. I mean, they're busy with stuff in the district anyway. So if we say, hey, second week of October, can we find 30 minutes to do a virtual meeting or something? We can make that work.
Okay. Does anyone else want to be involved in that meeting? Carol? Okay. So if you can keep us in the loop about that, Carson, because yeah, I'm excited if we found somebody who's interested in that topic. Okay. Any other things that you can think of in terms of update?
Yes, so the big one that we can probably, I want to set the stage for it, and we could probably spend a full other meeting talking about it in October as well. And that is the counseling compact. So I've kind of dug into that over the last couple of weeks and gone through the rules that they've promulgated. And they've actually done, from my perspective, they've done a good job addressing all of the concerns that I think we had when we read the initial just compact language. They've addressed a great deal of that in their rules and actually delegate a lot back to the home state. So, for example, the commission coordinates the actual database and reporting for adverse action, but member states are required to submit all that information to kind of the central hub. So the commission will aggregate the data and have, kind of run the file, but it's really up to the home state to report, hey, when something happened in your state and it was an adverse action, this needs, and you're a member of the compact, and you need to report that to the commission. And then it also, member states must implement an FBI criminal background check. So if your state, let's just use Virginia, for example, if Virginia doesn't require that right now to get a license in Virginia and they want to be a part of the compact, they need to implement that change and require an FBI criminal background check to then even be a part of the compact. So I think we're starting to formulate and get a better picture as to what the compact's going to look like. And they actually have another meeting on October 8th where they're going to go over another rule set. So that's via Zoom. I will be on that as well. Take notes, make sure everyone gets that information, and that's why I think at the next meeting we could possibly spend a great deal of time kind of walking through some of the stuff that was addressed at that commission meeting related to the compact.
Wonderful. I know that's something that members have been asking us about. Now, one question there in terms of the reporting aspect. So if there's an adverse action, say I'm a Michigan counselor and I'm practicing in, Indiana through the compact. And there's an adverse action against me in Indiana, for instance. Indiana would then be responsible for reporting that to the compact, or would they then refer that to Michigan's Board of Counseling for an adverse action?
The way that I understand it, could be completely wrong, is that it's almost a 2-point trigger. So I think it's actually both.
Okay.
Or there must be something where if in Indiana they report Chris, who's in Michigan, holds a Michigan license, and it goes to the commission database, I think there's got to be some trigger where it alerts Michigan.
That's something I'm really curious about, because that's been my biggest concern about the compact the whole time, is how that state disciplinary process is going to go, and how do we protect the citizens of Michigan from practitioners in other places potentially acting bad and then not getting any disciplinary action.
Yeah, I probably have to dive more into that, and people are probably going to have to pose different scenarios and kind of walk through what the protocol would be.
And during that meeting, or if any in any of these contacts you have with them, they would like to come in and speak with us again. Now that things have been fleshed out, because I know that was one of the issues that we ran into last time. Would you be able to kind of make that contact with them, or at least pass on a contact point for us to reach out?
Yes. I think we should plan on that. Getting that done this year and hearing maybe after that, the upcoming October 8th meeting that they have, maybe if it's in November or something, but I definitely think in between, and then their next one after that is January. So I think in between October and January, we should set something up with them again.
Okay, sounds good. Anyone else have any other questions for Carson? I was feeling bad for blabbing, so I'm glad I wasn't cutting anyone off.
I guess I have a question on the 25th of September.
Yes.
Would it be helpful for us to be there? How would you suggest that if we can make it there, how would you suggest that we approach legislators, anything like that? I've never done that before, so I'm just curious.
I think if we were to do something like that, we would want to plan it out further. And again, maybe it's November or December we do something. I think it's always beneficial and useful to do that and meet with your legislators. I just know in doing some other stuff, like the schedules for next Wednesday are basically already booked up, and I'm having difficulty even getting 5 minutes to drop off a check to someone, ironically. So I think if for getting the best bang for your buck per se, and getting the most out of it, probably looking at a later date to plan and, get materials together, get one pagers, have an ask in hand, or, hey, we want to talk about this, and really plan it out. So yes, I think we should definitely do that, at some point in the remainder of the year.
Could you let us know when that November date would be?
Yes.
Okay, thanks.
And last thing I did want to follow up as far as the LLPC bill. Has there been any movement in terms of that, or are we still just waiting for them to come back and start doing business again?
Still waiting to come back and do business. I don't even know if committees are meeting on Wednesday. I
Okay.
haven't seen anything even posted yet. So I don't even know if they're doing committee stuff, if they're going to spend the majority of their time, trying to pass stuff on the floor and get it to the other chamber, which is what my guess would be. So I don't have any inclination about a potential health policy committee.
Okay. All right. Well, if no one else has anything.
I just had two quick last things. One was the Board of Counseling meeting next October 18th. Make sure that I'll be attending and taking notes on that. And then there is also an opportunity that came to us about kind of opioid antagonists, and a Michigan order, and just talking about mental health and that kind of stuff. So I'm going to share, it's a sign-on letter. I will share this with everyone. If MMHCA wants to sign on, great, take a look at it. If not, no big deal, but just wanted to provide an opportunity to potentially sign on to something that has a broader coalition, and kind of put the MMHCA name on something that will be sent to DHHS and legislators and others. So could be a potential useful opportunity, but I will share that with everyone, and just take a look and let me know.
Sounds good. All right. Well, thank you very much, Carson. We appreciate your time today. And we'll be in contact.
Sounds good. I'll get that sent over, and everyone have a great rest of your day and weekend. And I hope any college football team that you may root for is successful tomorrow.
Thank you.
Thank
See ya.
you. Bye, Carson.
All right. And then I believe our other presenter is already here. Now, I noticed the last name is different than what I've been familiar with. Which is the correct one?
It's legally it's Morozevich, but I hyphenate it personally with Rigas Morozevich
Okay.
because Morozevich is so hard to pronounce and spell.
Fair. All right. Well, thank you for coming, Susie. And so you were coming to tell us about this broader kind of national coalition, pan profession, to advocate for the mental health services and in terms of how we relate to insurers. And so I was really curious about that. So
Yeah,
can,
I'm excited to be here. Thank you. This is the first time I've been asked to speak about the National Alliance of Mental Health Providers to a group, so it should be interesting. So this really came out from, a lot of discontent personally I had going back to like the Meridian and the Centene situation, a lot of payers being out of control with Medicaid and Medicare fraud, and a lot of states still extending contracts to them, which I just can't wrap my head around. Anytime we talk about fraud, it feels like they're looking at providers, but I don't know any provider that has paid $6.1 billion in Medicaid, Medicare fraud like Cigna has. So that kind of started some of the discontent. And then with the United Healthcare cyber attack, that really brought a lot of people together. And I know a lot of you here are, have seen those initiatives on Facebook grow and whatnot. And really what it comes down to is, for me as a social worker with the NASW is, and I'm not here to bash the NASW, social work has a very wide umbrella. And the NASW can only pick up so many issues to advocate on behalf of social workers, and what they have identified they will not pick up as an issue is any problems we have with insurance companies unless it's Medicaid and Medicare. And I really didn't see our Michigan chapter get that involved with the Medicare issue with Meridian last year either. And so we decided that this is a space that providers really need to come together in and start talking and figuring out how do we change this landscape, because I don't think a lot of the public knows that the provider shortage and the leading source of disease burden are not perpetuated by me or you or them, but by insurance companies, and insurance companies that change laws and set, create laws that work against us. And so in this space, we also recognized we didn't have a lobbyist. So we thought, a few of us got together and thought a good way for us to address some of these issues would be to create a new professional organization that would address this. And so we did. Right now, we have 2,600 members. It is free to join the Facebook group, but it is going to be there is going to be a fee in the future for the organization. We polled members to see what they really feel they want from a professional organization and what they're not getting. And the top thing was advocacy and lobbying, and then education and professional development, opportunity to lower cost CEUs or CEs, self-care initiatives, ways to honor diversity and inclusion, and then resources and tools. So those are the things we're really focusing on right now, with the first two being our primary focus. We are building a continuing education program. We do have a few free CEs coming up about practice management, negotiating with insurance companies. And then I'm doing one on the risks of telehealth platforms like Headway, Talkspace, BetterHealth, all of that. So we're still really new and young. We have a leadership team of about 5 people. We probably need about 20 more. I did just post that we are looking for regional leaders, because our goal is to separate into regions before we separate into all 50 states and have representation there as we grow. And beyond the continuing education, the other thing we're working on right now is getting a lobbyist and access to more help with advocating in this space. So it's really new, it's young, and but I'm excited as to the traction that it's built up so far. And I'm here to answer any questions about it.
How can you see? I know no one's asking a question. I hadn't really thought of one, but I kind of fill this awkward silence.
Mhm.
How do you see members, I guess, contributing or helping, other than, I know, eventually paying dues perhaps to contribute toward lobbying, but what kind of opportunities for involvement, or what would be helpful for people that are interested to do?
That's a really good question. So what kind of actions do I see members partaking in? I would say I would start with whatever they're willing to do, right? I know, like right now, a lot of members are writing letters and advocating about this issue, meeting with different state reps, meeting with, we just had the president of Highmark. We had some correspondences with him in which he said that they should pay nurse practitioners more to do mental health care than mental health licensed clinicians. And so that happened last night. Right now, it's just been a lot of grassroots. We are working on planning a national conference. So I'm looking for people who would be interested, not just in that, but in providing CEs. If you have a course or a lecture or like a topic that you're interested in, I really am looking for presenters for CE programs, not just for the National Alliance, but also for my organization, which we're using the CEs for my company right now for the National Alliance until we get the CEs approved under them. But, and even thinking back, like with the Medicaid issue in the state of Michigan, last year I printed up little cards that just showed all the rates for the states around us and how we were like a half to a third as much as some of the states around us. And I slipped those under the doors or handed them to every representative in the state in Lansing or one of their assistants. And I just little actions like that, I feel like makes a big difference. So what I would say is get involved any way they want, any way you want to. We are still looking for people to help with leadership. We did just bring on a PR rep, which, a lot of you guys are familiar with the issues we had with Meridian in the past and in the state of Michigan with the Medicaid rate. The one thing I feel that we did not do with that Meridian situation that we should have done is gone to the public, and we didn't. If the public would have known that the state of Michigan was going to extend a contract to a company that had committed so much Medicaid and Medicare fraud, I don't think they'd be too pleased about it. Well, at the same time, when those negotiations passed, if I'm to understand correctly, they limited Priority Health's contract. And I don't know why, but I will tell you, Priority Health has paid zero in Medicaid and Medicare fraud penalties. So I'm very happy about having someone that has a history of PR involved. Miss Marcina has 20 years of PR experience and then is also a licensed marriage and family therapist. So I think that that's something that I'm really excited about now is bringing that into more of my advocacy efforts. Does that answer your question? I feel like I'm.
Yes, that was very helpful. Thank you.
Thank you. Thank you for asking a question too.
I was giving a space before I started blabbering because then usually I just keep asking questions. I guess one thing I was wondering is, have you noticed anything about like the levels of engagement across different professions? Does it seem to have traction
Yes.
in all the different areas?
We have, so I approve the membership requests on the Facebook group right now, and I am floored by first of all, how many we get, how many requests, how well received this has been. I mean, I think we started the group in May or June, and we have 2,500 members already. What I'm seeing through the voices of the providers joining is that there is a real need for this. The other thing I think is playing into a lot of this is during the pandemic, a lot of providers went out on their own because they were afraid to stay in their position and they wanted to utilize telehealth and be more safe in the pandemic, and all that's great. But insurance companies really exploited that, in my opinion, understanding that individual providers aren't going to have the protections and the understanding of what's going on as a larger company. And as someone who's been practicing telehealth and getting paid for it by insurance companies since 2016, I saw a lot of misinformation during the pandemic being what I felt was deliberately handed to clinicians on how to bill for telehealth. And what they were trying to get people to do was bill for phone counseling sessions, which bill at like a third of the rate. So now flash forward to where we're at, we and on the one hand, we became more fragmented. I think the veil that some of the organizations that we worked for got lifted, and we got to see kind of more of what's going on as solo and individual practitioners. And in that, there's a real frustration with what's going on with insurance companies, because I think a lot of those providers chose to do their own billing during that time and started to realize how ridiculous it is. That's my thought. Does that answer your question?
Yeah, no, it does. One thing I'd be kind of curious about too is in terms of, you mentioned this earlier that, with the President of Highmark remarks, um, him saying that, nurse practitioners should be paid more for what we do. That's always something that struck me as very odd in our profession is that medical
Mhm.
doctors with no training in what we do get
Mhm.
reimbursed at higher rates. And I was wondering if one of the priorities of this organization could be to push for at least an evidence-based
Yeah.
reimbursement um, schedule.
One of the things that I think is important is that we understand there's a fair market value to our services, and that we stop rewarding, um, for lack of better words, shitty payers to contract with us for less. And so we're sharing some of those negotiations. We're also dropping the veil of don't share your rates. We talked to an attorney. We can share our rates. This is never a thing. They just want us to believe it wasn't. Um, our rates are posted. CMS posts rates. But going back to the issue of like a fair market value rate, and maybe I'm wrong, but I feel that Medicare does set a somewhat fair market value for our services. There are fair market values out there. But when Cigna comes along with their, $62 90837 reimbursement and then $58 90791 reimbursement, that's where we as providers have to say no thank you. And so I did just in good faith reach out to Cigna before I ended our contract and say, listen, you're paying us, basically a fraction of what everyone else is. We can't sustain. And their first offer to come back was they offered me the same rates.
Mhm.
So then I went back and said, this isn't acceptable. It's going to have to be 120, and they won't do it. They'll maybe do a few dollars, but we're going to drop them. And I would encourage anybody who is contracted with a payer that is not paying you enough to drop them. And I wouldn't, I mean, you have to obviously work through what you're going to do with your patients in those situations, but you can make a plan to drop them in the future. Um, there's a lot going on in that space in terms of payers.
Yeah,
And the ones
speaking
that
of
were going,
Cigna, I
yeah.
I'm in the midst of a negotiation, and basically their way of
Mm.
dealing with me since May, because this is all, is to give me then bogus emails to send my request to, and then I
Yep.
get a return, and then I make phone calls and I get
You're going to love this
several
story.
different people. Yeah, and then it is frustrating as I'm working with patients who have Cigna who are paying their
Hmm.
premiums for this coverage to have to come back to them and say, there's a good chance I'm not going to take this. So right now I'm waiting because the woman who has my request is on
Is it
vacation.
Mary?
Yes. It's
Okay.
on
I'm,
vacation for a couple of weeks.
I'm going to say something that's really going to tick you off. They got my request back to me within a week. And here's the difference. And I've been doing this since 2016. And I started out
Mhm,
as an individual practitioner and doing
mhm.
all my own billing and credentialing. They won't listen. They will give the individual practitioners a runaround. But now that I have a company and I have 30 clinicians,
Yeah,
they give me different treatment. And that's not okay.
yeah,
And
yeah.
everyone, we need
Mhm.
to be talking about that,
Yeah.
you
Well,
know?
they told me, they gave me an option about a year and a half ago to go up from $68 to 76. And I said, that's still unacceptable. And then crickets, I didn't hear from
Yeah.
them. And
Yeah.
so I didn't have Cigna folks for a while. And then I started getting some more. So
Mhm.
I contacted them again, and, crickets there. And
Yeah.
they told me in their offer to go from 68 to 76, don't talk to other practitioners about this.
Yeah.
Well, of course, I go down the street and I'm talking to other practitioners about this, and they're getting paid significantly more than I am.
Do you know who else is too? Is groups backed by venture capitalists.
Yep.
Okay.
That's how
So when
Headway
they
and all
tell you
those
that they can,
function.
what was that, Chris? Sorry.
That's how Headway and BetterHelp
Yeah.
function is that they get
Yeah.
way
Yeah.
higher rates.
Yeah.
And the board is familiar with my concerns about them trying to price us and push all of us as independent, we're small business owners out of
Right.
the space. Because
They are, and they're
eventually,
trying to change laws to make what they're doing more legal. But here's the issue. I was trying to cut you off, but this is what most people have to realize with those companies. You're the covered entity. You're the covered entity.
Mhm.
Okay. So you have all the responsibility of data privacy, security, maintenance, and you have no control over it.
Right.
You're
Yep.
the covered entity. They're the business associate. That shouldn't even be legal.
Yeah. Yeah.
So, and I don't think it's okay with our codes of ethics and our professional license either to not have, you're signing up with a company that we know has been sued for selling transcripts of sessions. So I get real heated about that whole situation because informing my telehealth company, I went through all the tedious steps to become a covered entity, and to get credentialed. Then when I met with companies like ADHD Online, which is now Mentava, because they're from Grand Rapids too. They ruined their whole brand because they marketed and didn't have a service, and they left people high and dry in the medical space with medications. They were diagnosing ADHD without even meeting with the person and prescribing. And when I met with them, they told me, well, first of all, they tried to acquire me because I was a covered entity. And they told me that they just didn't want to deal with all the administrative burdens of doing that. And that's kind of the mentality of those large companies, is what makes therapy work is that privacy, security, confidentiality, the fact that it's a healthcare procedure, all of that. It's not just two people talking. And yeah, anyways, I'm not going to soapbox about that. I do that all the time.
Carol.
Oh, thank you.
Susie, is one of the goals of the group ultimately some federal legislation?
Yes.
Okay.
Yeah. It's what's really scary right now is what's happening in that space where we do have those venture capitalist groups and those large insurance companies now setting the standards for laws. It's no secret that we live in a country that is governed by corporations. And this is a very scary space when you think about it, in my opinion, with the gun violence and mental health. And we have a country whose suicide rate just went up from like the second highest leading cause of death for 14 to 24-year-olds to 10 to 35-year-olds. And then we have a country where everyone can get a gun. And we have to consider suicidal people homicidal as well. We have a national disease burden of mental illness that has been the leading source of disease burden, and a provider shortage that has spanned over 2 decades. And it's just growing and festering, and it's becoming a real problem. It has been a real problem, and our legislators are not taking care of it. I can't tell you how many local representatives from Michigan last year told me, we're not going to give Centene a contract. We're not going to give Meridian a contract. We're going to bring this to the news. We're going to do this. And nothing. So.
And so one thing I'd be curious about, maybe this is outside the scope of today's discussion, is your view on things like the Council Compact and SciPact and all of these things which bring down the burden between states, and whether that's
awesome.
Well, and the thing that I've wondered about, and maybe think on this a little bit too, is how much does this open the door for companies like Headway, BetterHelp, who have been acting in ways of like setting up providers to see clients outside of states where they're licensed?
Have they been doing that?
Oh yeah, there's lots of stories of that.
No shoot, really?
Yeah, and there's nothing in their terms of services.
I'm going to tell you how they get around this, is because if you look at their terms and conditions, they're not providing therapy.
Yep.
It's not therapy. So if you're not providing therapy, then you can talk to anyone anywhere else around. If they're considering it coaching, you can be a coach to anywhere and anywhere in the country. But the problem with that is then the risk lands back on the provider. You're saying you're providing therapy, but you're not diagnosing. You're not doing a full evaluation. You're not creating a treatment plan. You can't coordinate care with these places. I worked at Able To before they went to the other model. It's not built in their platforms to do any of that. And when you sign up to do it, you sign up to say you're not providing therapy. It's just it's self-help is what it's called. So I'm guessing that's how they're getting around that.
See, and what I bet, and that what I'd be curious to look at their contract is that they're using the platform exception, just like Uber and all these other companies like ride shares and stuff like that. They're doing a rideshare model to where it's not on them, it's on the provider. And if the provider gets busted for it, well, that's not on us. You sign the contract.
I'm shocked providers haven't, quite frankly. There is a lot of indemnification clauses in their contracts for patients and for providers. So the company is not liable
Yeah.
for anything. But I'm shocked that one of the patients whose sessions transcripts were sold for marketing purposes, or some of them haven't come back in the class action lawsuit against these companies and for their data privacy issues. But again, when the patients sign those contracts, they're not looking at what they're signing. And I guarantee they're setting up any ability to sue the company. But who can get sued? The
Us.
provider.
Yeah.
Yeah. Yeah. And I do not think our malpractice insurance will protect us in a situation where we're saying we're providing therapy, but we're not providing therapy. I don't think they would.
Okay. Does anyone else have any other questions? Because we're starting to run low on time, and I don't want to. I
do appreciate the space you guys carved out to come and let me talk about this. We are real excited. I do want to say about the site compacts and when I hopped in, you guys were talking about your compact. I think it's great. I think it's what we need as a profession. I'm very frustrated that the NASW does not have one. Any efforts that we had made towards getting close to one got sabotaged when the data about the racial bias and the standardized testing scores got hacked into and leaked last year. So nobody wants to use the ASWB anymore as a licensing exam. States are thinking about dropping the exam. And it just pushes us as social workers that much further back. And it's sad.
Well, and I think, I think I'll talk with everyone else here too, but I think that, us working together and partnering on some of these things, I think is a definite possibility. And so I hope to be able to talk with you again soon.
Yeah.
Yeah.
And that's why we wanted to make it multidisciplinary, because when and really the group is professional mental health providers. There's so many more of us in numbers when we do all join forces.
You're speaking to the choir on that one.
Yeah, right.
So
Susie, thank you so much for all your work on that national group. I'm amazed at what you all have done already. It's really exciting.
I'm excited and terrified. It's grown so fast, so big so fast, but I'm very excited. I'm honored to be here. Thank you so much. And thank you for all the work you guys have done.
Thank you.
Thank
We'll
you.
see
Have
you
a good
soon.
one.
You too. Bye.
Bye. So that was informative.
Very. That was really good.
And I do think that would be a good partnership for us. I know that you guys have heard me on my soapbox about several of those issues. So I'm also curious about hearing from you on that. Is there any other business that anyone wanted to address today, Carol?
Chris, yeah, next week or next month, since the Board of Counseling meeting is at 10, will we meet at 9 next month and then 10 o'clock after that?
I was going to ask, or if we could offset that week, if people have another Friday at 10 a.m. open. I wouldn't mind even doing the week after theirs. I don't know what this sets that on the calendar so that we can actually go over and review what occurred at the Board of Counseling meeting. So I think they're on the 18th. Is that correct?
Mm-hmm.
Yes.
Yeah.
So if people would be available the 25th, and if we could do 10 a.m.
I can make that work personally.
Okay.
Works for me.
I may be out of town. I haven't confirmed my vacation, but so it could conflict with either of those dates. So I may be absent
Okay.
either way. So don't schedule it around me.
Larry?
I think that probably would work.
Okay. And Joy, do you have anything to add there?
No, it works for me.
All right. So our next meeting will be October 25th at 10 a.m. All right. So all of you, I hope you have a wonderful month and hope stay in touch. And Lori, I'll reach out to you after I get back from vacation. Go ahead, Larry.
Fantastic.
I make a motion, we adjourn.
I second that motion, Larry. Everyone in assent, please say aye or raise your hand. Aye.
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 All right. We are adjourned.